Cold and heart, increased risk of heart attack in winter? Is your heart doing well with all this cold we're going through? Hello everyone, my name is Fábio. Today I'm going to talk about the 7 health problems related to cold and temperature drops that can impact your heart and circulatory system, even if you think everything is fine with your health. Stay until the end because there's a bonus tip that will definitely help you a lot, don't miss it. I will try to answer the most frequent doubts about cold and heart. What does cold cause in the heart? Why in the cold it hurts the chest? Why heart attacks increase in winter? And what to do to avoid a heart attack at the coldest time of year. So don't miss out. Stay until the end. But first, you're already enjoying the video, because the more people like the video, the more YouTube distributes to those who don't have access to doctors or hospitals, and also share the video with your acquaintances. And tell me, do you have any heart problems? Do you suffer a lot from the cold? Right down there. Come on. Did you know that, really, low temperature can cause important changes in the functioning of the cardiovascular system? What can the cold do to your circulation and your heart? Exposure to cold causes your blood vessels to constrict, which we call vasoconstriction. Your arteries and veins narrow, reducing blood flow and oxygen to your heart and tissues. How does this happen? When it's cold, nerve receptors in the skin stimulate the sympathetic nervous system, increasing the release of adrenaline, so you don't lose heat in your extremities and keep your body warm. And this hormone can cause a worsening of vasoconstriction and other consequences. Also, in winter, there may be a lack of sun, which can make people exercise less, and without sun, and when it gets dark earlier, people tend to get more depressed. And there is a correlation between depression and heart disease. Also, in winter, air pollution increases, which can harm the lungs and heart. So I'm going to point out here what happens to your body with the cold. First, your blood pressure will go up. It's true, the cold increases your blood pressure. That's why when the temperature drops we see an increase in blood pressure. People go to the emergency room more due to high blood pressure. And you have to treat, sometimes increasing medication, reducing salt, eating more fruits and vegetables, the things that you, who follow our channel, already know by heart. Why does the pressure increase? All because of adrenaline and peripheral vasoconstriction to prevent heat loss. Systolic blood pressure can increase by 5 to 30 millimeters of mercury, and diastolic pressure, the minimum, can increase by 5 to 15 millimeters of mercury. And look how interesting, blood pressure can also be affected by a sudden change in weather, such as a cold front or a storm. The body and blood vessels can react to abrupt changes in humidity, atmospheric pressure. It leaves sea level and goes up into the mountains, the pressure rising in the same way it reacts to cold. And these weather-related blood pressure variations are more common in people over 65, increasing the risk of hypertensive crisis and strokes, heart attacks, and aortic dissection. In addition to pressure, what the cold causes, second, it worsens heart failure, which is a weak heart. Cold increases the work of the heart muscle. And this increase can decompensate a patient who already has a weak or enlarged heart. In addition, respiratory infections, which are more common in winter, such as the flu and colds, can worsen heart failure. In Brazil, they carried out a study based on SUS data in the city of São Paulo and saw that, between June and August, there was a 30% increase in hospitalizations for heart failure in public hospitals in the city. The cold burdens a heart that is already weak. 3 but the most classic of all, the third. Increase in angina and infarction. Angina is that chest pain or discomfort. Stable angina is when you exert yourself and feel pain in your chest, and unstable angina, which is the most serious, when the pain happens even at rest. Well, in the cooler external environment, vasoconstriction will occur, which reduces the diameter of the arteries in the body, including the coronary arteries, which supply your heart. We see a lot of people who have never felt angina have their first episodes with thermal shock, freezing winds, or going outside from a hot place. And this vasoconstriction, associated with increased pressure, can break the atherosclerosis plaque, the fatty plaque, causing a heart attack, infarction if it is in the coronary arteries, or a stroke if it is in a cerebral artery. And the cold increases the risk of thrombosis and platelet aggregation, making it even easier. Fourth, cardiac arrhythmias. Cold increases the risk of arterial fibrillation and other supraventricular and even ventricular arrhythmias. The simple act of immersing your hand in cold water while holding your breath can cause cardiac arrhythmias such as supraventricular tachycardias. And cold can increase heart rate, especially when you inhale cold air. There is a slight increase in heart rate in the range of 5 to 10 beats per minute. Fifth, stroke. Both ischemic and hemorrhagic strokes increase in the cold. For all that I said high blood pressure, cardiac arrhythmias, vasoconstrictions, and planetary aggregation, so much so that in the cold the risk of heart attack and stroke increases by 30%. And sixth, increase in deep venous thrombosis due to increased platelet aggregation, worsening of blood circulation, doing less physical activity, and, as a consequence, increased pulmonary embolism. And this combination of factors causes mortality due to circulatory problems to increase in winter. What to do? To protect the heart in the cold, we have to have common sense, like having a healthy diet and avoiding smoking. If you start to experience angina, chest pain, or chest discomfort, you have to see a doctor before having a heart attack. And if you already have coronary artery disease, you should limit your exposure to the cold and wear warm clothes and cover your... And before I forget, here's the bonus tip, guys. I've been researching and I saw a new product that is CardioFlex, the first and only formula designed with the 9 main hypertension cures that are proven to control PLR15 levels, slow the wear and tear on the heart, and clean the arteries while naturally lowering the blood pressure. Hi, in a few minutes. Take a look at the site and meet people who have already used it and suffered from arterial problems, and to help you I will leave the link below in the description of the official site for those who are interested in knowing more. Take a look, because you will not regret it, and run because it is running out quickly. According to my research, CardioFlex is standing out with a guarantee of up to 60 days and with many other benefits for your heart health. A hug and stay with God until next time. Did you like the video? And remember to share so more people have this knowledge. Remember to subscribe.